Hi, good morning, everybody. My name is Isha, and my group members are Haley, Himani, Indumol, and Sonali. And our topic of today is hemophilia. And the key points that we're going to discuss are definition, causes of hemophilia, age, race, and sex, location, clinical, radiographic, microscopic features, oral manifestations, diagnosis, prognosis, and the treatment. And we will be discussing EDPI considerations and alteration to dental hygiene practice, and we'll be discussing references as well. So, what is hemophilia? Hemophilia is a blood disorder. So, do you know how fast your blood clot after a minor cut? It does depend on the clotting factors and the calcium levels, but normally it does clot in minutes. Normally, it clots in 2 to 8 minutes, but it doesn't happen in case you have hemophilia. So, the definition hemophilia is an inherited bleeding disorder with any chromosomal recessive inheritance pattern. It is characterized by the deficiency of coagulation factor. Factor 8 is hemophilia A. Deficiency of factor 9 is hemophilia B, which is also called Christmas tree disease after a person who was first discovered. And factor 11, which is hemophilia C. So, how it normally works. In the normal human being who have a normal vessel, normal clotting factors, when the injury happens, the clotting factors are activated. Platelet plug formation occurs and it forms a stable blood clot, but not in the case of client or a patient with hemophilia. They'd have a normal blood vessel injury. Injured blood vessel clotting factors are activated, but due to lack of clotting factors 8, 9, or 11, weak platelet plug formation occurs, which leads to delayed fibrin clot or incomplete fibrin clot. Hemophilia is of two types, congenital hemophilia and acquired hemophilia. So congenital hemophilia is basically it's a congenital defect passed down from parents to children. And then we have acquired, which is only associated with diseases like cancer or pregnancy or certain drug interaction. The drugs actually targets your immune system. Females are normally the carriers. Sex-linked disorder, location is X chromosomes, and mostly males are affected. If you see this gene diagram, we see unaffected father and a carrier mother. So you see the answer, we have unaffected son and affected son, but the chances of daughter to have hemophilia is 0% because we only get unaffected daughter or carrier daughter. So the probabilities are 50% sons are affected and 0% daughters are affected. We have a short video that explains most of the things related to hemophilia.
So, what is hemophilia? Hemophilia is a bleeding disorder, a problem with a person's blood that makes them bleed longer than a person without hemophilia. No one can catch hemophilia. It's an inherited condition you have from birth for your whole life. It's just part of who you are, like the color of your hair or the shape of your nose. Here's how it works. Your blood travels through your body in tubes called arteries, veins, and capillaries. Normally, when there's a tear or hole in one of these, bleeding starts, and different parts of the blood go to work to plug the hole. Blood cells called platelets gather at the opening, and other blood parts called clotting factors help hold the platelets together to form a clot that stops the bleeding. When a person has hemophilia, he doesn't have enough of one of those clotting factors he needs to form a clot, and he keeps bleeding longer than he should. Each person with hemophilia is missing one of two kinds of factors. If you're missing factor 8, you have hemophilia A. If you're missing factor 9, you have hemophilia B. Either one can be mild, moderate, or severe. Without regular treatment, having hemophilia means you'll bleed longer than you should if you get cut, but you don't have to have a cut to have a bleed. Sometimes, especially when you're active, the tiny capillaries inside a person's body will bleed, causing a bruise or pain in the joints. Not dealing with those kinds of bleeds can cause a lot of problems later, including arthritis at a young age. Aww. But the good news is, there are good treatments available that can help you manage hemophilia effectively. Treatments that replace the missing factor help your blood clot more like a person who doesn't have hemophilia. These treatments, when used properly, help you keep your bleeding under control so you can live a long, healthy life. and follow your dreams without hemophilia ever holding you back. To learn more about hemophilia, visit worldhemophiliaday.org.
Clinical features of the hemophilia. The sign and symptom depends on the level of the clotting factor, which can be mild, moderate, and severe. Mild hemophilia. The person presents with mildly reduced clotting factors, so only bleeds after surgery or trauma. People with the severe hemophilia have a deficiency of the clotting factor, so they bleed very easily. The main feature is an excessive or prolonged bleeding after injuries, tooth extraction, or surgeries. Bruising is another common feature. Bleeding in the joints, muscle, and the soft tissue that can lead to pain, swelling, or tightness in the joints. Bleeding in the mouth, nosebleed, or the blood in the urine or the stool. Mucocutaneous bleeding after the vaccination. Intracranial bleeding can be life threatening. Internal bleeding is present in the severe type, which can affect the multiple organs such as liver, kidney, and spleen. Radiographic features. The radiographs are important to diagnose the type of the hemophilia. The hemophilic atrophy is most commonly present in the people with the hemophilia. The features are joint destruction and deformities, narrowing of the joint space, epiphyseal overgrowth, especially in the children, moderate joint effusion, erosion, cystic changes, loss of cartilage. Hemophilic pseudotumor can occur rarely. Soft tissue hematoma and life-threatening hemorrhage can be serious.
Microscopic features. Clotting factor deficiency. Lack of clotting factors 8 or 9, which disrupts blood's ability to clot. Insufficient platelet aggregation. Platelets are unable to form strong clots, resulting in weak clot formation and difficulty stopping in bleeding. Irregular fibrin network. Fibrin network holding blood clot together is faulty or incomplete, causing clots to be unstable and break apart. Presence of microhemorrhages. Next. Oral manifestations. Petechiae and ecchymosis. Platelet deficiencies can cause petechiae or ecchymosis in oral mucosa and promote spontaneous gingival bleeding. Hematoma on the tongue, hard palate, mucosa, floor of the mouth, and brown deposits on the surface of teeth due to chronic bleeding. Spontaneous gingival bleeding. People with hemophilia may have multiple and spontaneous bleeding events over their lifetime. The frequency of bleeding depends on the severity of hemophilia. Post-extraction hemorrhages. The incidence of dental caries and periodontal disease is higher in patients with hemophilia, which may be because of lack of effective oral hygiene and professional dental care due to fear of oral bleeding. So, it's essential to prevent accidental damage to the oral mucosa when carrying out any procedure in the mouth. Hemarthrosis of TMJ. Hemarthrosis of TMJ, articular bleeding into joint cavity.
Now we have the diagnostic process. Some of the diagnostic tests that are used to detect hemophilia are laboratory tests, family history, clinical manifestations, genetic counseling, genetic testing, the levels of clotting factors, and factor VIII inhibitors. Testing is often done by checking the level of clotting factor by obtaining a blood sample from a vein of a newborn, or the most accurate technique is getting blood sample from the umbilical cord and finding lower levels of factor VIII. It is routine in most hospitals now to measure factor VIII inhibitors. We do have some of the blood tests that help identify hemophilia. Among them are prothrombin time, partial thromboplastin time, bleeding time, and complete blood count. And some of the others are the platelet count, fibrinogen, INR as well. There are diagnostic imaging tests that can detect internal organ bleeding. So if you have like abdominal or thoracic bleeds, CT scans are used. And to rule out intracranial bleed, it is an MRI that's used. And if there are recurrent joint bleeds, an ultrasound is used as well. So the prognosis of hemophilia, the life expectancy in the 1950s was 11 years. There is still no cure for hemophilia, but people who receive treatment live longer and chronic complications can be reduced. Life expectancy in the developed country is the same as of the general population, but in the developing countries, the death rate is twice as of the general population due to lesser treatment options.
Treatment. Replacement therapy. Replacement therapy involves infusing clotting factors 8 or 9 to compensate for missing proteins in hemophilia. Prophylactic treatment. It consists of regular injections of clotting factors to maintain a stable level in the blood, which helps prevent spontaneous bleeding and minimize long term damage to joints and tissue. Gene therapy. Gene therapy aims to insert a functional gene into patients' cells, enabling them to produce their own clotting factors. Now let's talk about ADPI. Assessment. Oral examinations identify signs of bleeding, mucosal hematoma, inflammation, and periodontal disease. Diagnosis. Spontaneous bleeding is often confirmed by blood test, antifibrinolytic medications, or replacement of clotting factors. Planning. Preventing measures to avoid bleeding. Advise soft bristle brushes and carefully floss. Educate the client to use non alcoholic mouthwash. Implementation. The client should coordinate with the physician to ensure clotting factors are maintained and bleeding should be controlled while doing invasive procedures. Evaluation. Evaluate client response after and provide suitable post op instructions. CDHO fact sheets. So the question is, do we require medical clearance for invasive dental treatments? Yes, we do require medical clearance. And we have two links provided at the bottom of the page. 17th April is declared as World Hemophilia Day. Here are some references. Thank you for watching.